Good evening to you once again. SADC countries are working hard to ensure that their citizens are vaccinated for COVID-19, while procurement of vaccines have been a challenge as SADC has been able to receive its Covax vaccine doses allocation. Leaders in this region are pulling all stops to ensure that the citizens are vaccinated and the challenge of vaccine skepticism is addressed. So with the third wave looming, countries are also working together to ensure that they're monitoring particularly South African provinces that share borders with other countries. Limpopo is one province that is vigilant and has intensified its vaccination campaign. For more on this, we're joined by the Limpopo Health MEC Dr. Phopi Ramathuba. Very good evening to you, MEC. Thanks indeed for your time. So, your province, which is linked to Zimbabwe and Mozambique, we also saw the vaccination of 2 bishops there. Obviously, their following is very strong in the SADC region. Limpopo is also preparing for the third wave. This is quite significant, is it?
Evening, Criselda, and evening to all your viewers out there, and thank you very much. What we can indicate, yes, indeed, it's quite a significant, it's a major boost, especially for our vaccination campaign. We should indicate that as a department, we are really humbled by both the bishop for having agreed and came and show leadership. But also we must remember that even from the beginning of fighting this pandemic, both His Grace Dr. B.E. Likhanyane and also St. Agnes Bishop Joseph Likhanyane, they have been providing leadership to their members, because when you look at their membership, I stand to be corrected. The last time, just for the ZCC alone, you are talking between 13 and 15 million. 13 of those being in the country, South Africa, and 15 across the continent. So you are talking about 15 million followers. Now, when you vaccinate such a leader, it tells you a lot about the leadership styles of that particular spiritual leader, that he cares about his followers. And if you remember, last year, they were the first one, after we have met with them, to agree to close their church. And even when others were threatening to take us to court, they made a call, say, can we agree to say we want to have our Easter as a celebration as it has always been traditional. So for us as a province, we are really humbled by what we saw happening yesterday.
Yeah. And MEC, how prepared are you as a province to deal with the third wave, particularly looking at border movements?
We can indicate that our strategies will continue to be the same. We have working with the National Department of Health. We continue to strengthen our port health, where screening, like this time around, when we are seeing that in numbers, especially in other provinces, are starting to increase, even with us as a province, Criselda. Last week, I can say to you that we were registering less than 30 cases within 24 hours. This week alone, we've been registering around 74 cases on average within 24 hours. So that tells you that we are not really exempted from the looming third wave. So that is why the first strategy, making sure that strengthening the border port health, where the screening of anyone who enter the country must continue. And also, you remember last year, early this year, we introduced the antigen testing. We're still going to continue to test as the people enter the country. But also the messages of, as long as we are still waiting for the vaccine, let's continue, even those who have been vaccinated, for behavioral change of wearing of our mask, the non-pharmacological intervention. But most importantly, we're saying we've entered the stage of a primary prevention through a vaccine. That is why we are working very hard to make sure that we spend these 2 to 3 weeks vaccinating many people as possible. Because if we do that, if the third wave finds us having vaccinated a lot of people, the situation will not be as dire as like we saw with the second wave.
Yeah. And hopefully it doesn't get to that point, MEC. You're part, of course, of the health department teams that are preparing for this eventuality. I mean, would you be likely then to see tighter restrictions in the coming weeks, or even a move to a higher level? I speak as you being part of that bigger team of discussions around where South Africa needs to go to try and deal with this.
I think what we need to appreciate is that when the need arises, South African government will always put the lives of its people first. Mm-hmm. If we start to see numbers getting uncontrollable, hospitals being full and failure to really deal or cope, then we will live with the president with no option, and the National Command Council will have to meet and make such decision and make such calls. But I want to believe that South Africans have cried and have mourned enough. We've seen our loved ones dying. And there's the third wave. I want to believe that as South Africans, we are now working together. We have seen that even those voices that have been anti-vaccination are starting to be overcome by more positive voices of the leadership that is showing that the virus does exist, it's real, and the vaccine can be able to assist us, and non-pharmacological intervention can assist us. So I think I am positive that this time around we will not find ourselves with the January and February. I am hopeful, but we should not drop the ball. I've seen it's weekend on social media. People are partying, there are weddings that they're attending, people are relaxing, there's no wearing of masks. I just want to re-emphasize and make another call to say, please, this is a very difficult period that we are facing. We better prevent this virus than being sick and think that our ICU will save you. We've seen people dying with those ventilators. So really, let's not rely on the ventilator. Let's rely on the mask, on the sanitizer, and on social distance. And also, finally, let's rely on the vaccine.
MEC, I'm afraid that's all we have time for tonight. Thank you very much indeed. We certainly hope that those numbers don't reach that point. The Limpopo Health MEC Dr. Phopi Ramathuba joining us on the program.